Common challenges you may face with a Medicare Advantage plan. Medicare Advantage plans, also known as Part C, offer an appealing alternative to original Medicare by bundling benefits like prescription drug coverage, dental, vision, and hearing into one plan. However, while these plans provide added perks, they come with potential pitfalls that beneficiaries should carefully consider. Issues such as limited provider networks, unexpected out-of-pocket costs, and prior authorization requirements for certain treatments can create obstacles in accessing care. Additionally, regional availability and coverage restrictions may not suit everyone's needs. Understanding these challenges is essential to making an informed decision and ensuring your healthcare choices align with your medical and financial goals. 1. Limited provider networks. Many Medicare Advantage plans require beneficiaries to use a specific network of doctors, specialists, and hospitals. If a preferred provider is outside the network, the plan may not cover services or will charge higher fees. This limitation can lead to difficulties in accessing specialized care or continuing with trusted healthcare providers. For individuals living in rural areas or needing frequent medical care, this can be particularly challenging. To avoid disruptions, beneficiaries must verify that their providers are in-network before enrolling. Staying within the network also requires ongoing vigilance, as networks can change annually, impacting access to care unexpectedly. 2. Out-of-pocket costs. While Medicare Advantage plans often have lower premiums than original Medicare plus supplemental coverage, out-of-pocket costs can quickly add up. Beneficiaries may face co-payments for doctor visits, co-insurance for hospital stays, and additional fees for services like durable medical equipment. These costs are often capped at a maximum out-of-pocket limit, but that limit can be high, particularly for those with chronic illnesses. Unlike original Medicare, which allows separate supplemental plans to reduce expenses, Medicare Advantage plans integrate all coverage, leaving beneficiaries with fewer options to manage out-of-pocket costs effectively. Careful budget planning is crucial to avoid financial surprises. 3. Prior authorization requirements. Medicare Advantage plans often require prior authorization for certain treatments, tests, or medications. This means that before receiving care, beneficiaries must seek approval from the insurance provider, which can delay or even deny access to necessary treatments. This process can be particularly burdensome for those requiring time-sensitive care, like cancer treatments or surgeries. Navigating the authorization process can also involve significant administrative hurdles, causing frustration for patients and healthcare providers alike. Beneficiaries must understand the plan's requirements and remain proactive in ensuring their healthcare needs are met without unnecessary delays. 4. Regional coverage limitations. Medicare Advantage plans are typically region-specific, meaning coverage options and provider networks vary by county or state. This can be problematic for individuals who split time between two residences or travel frequently. Coverage outside the plan's service area may be limited, even in emergencies, leading to unexpected costs. Beneficiaries moving to a new region may also need to switch plans entirely, which can disrupt care continuity. Those considering Medicare Advantage should assess whether the plan's regional restrictions align with their lifestyle and future mobility needs, ensuring they have access to care wherever they reside or travel. 5. Drug coverage restrictions. Many Medicare Advantage plans include prescription drug coverage, but formularies, the list of covered drugs, can be restrictive. Medications not listed in the formulary may require beneficiaries to pay full price or switch to alternative treatments. Additionally, plans may impose quantity limits, step therapy, or other requirements before approving coverage for certain medications. These restrictions can create challenges for individuals managing chronic conditions that require specific drugs. Beneficiaries should carefully review the formulary before enrolling and remain vigilant about annual updates to ensure their essential medications remain covered without unexpected disruptions. 6. Limited emergency coverage. Medicare Advantage plans may restrict emergency coverage outside their network or service area. While plans are required to cover emergencies, what qualifies as an emergency can be ambiguous, leaving room for denied claims. For frequent travelers, this limitation can be a significant drawback. Non-emergency medical care obtained outside the network often isn't covered, even when urgently needed. Beneficiaries should thoroughly understand the plan's emergency coverage rules and consider whether their travel habits necessitate supplemental insurance for additional protection, especially for international travel or extended stays outside the plan's service area. 7. Annual plan changes. Medicare Advantage plans can change annually, altering premiums, benefits, networks, and coverage rules. Beneficiaries must review their plan's annual notice of change to understand how these adjustments may impact their healthcare needs and finances. A network provider may leave the plan. Drug formularies may drop key medications, or cost-sharing structures may shift. Without careful annual review, beneficiaries could unknowingly face higher costs or reduced access to services. Staying informed and comparing plans during the annual enrollment period is essential to ensure the selected plan continues to meet medical and financial needs. 8. High maximum out-of-pocket limits. Although Medicare Advantage plans have a cap on out-of-pocket expenses, the limit can be high, sometimes reaching several $1,000s. This means that individuals with frequent medical needs or chronic conditions may still face significant financial burdens, even with insurance coverage. Unlike supplemental plans under Original Medicare, Medicare Advantage doesn't allow additional coverage to lower these limits. Beneficiaries need to consider their healthcare usage and financial capacity when selecting a plan, ensuring they can manage costs if they approach the maximum out-of-pocket threshold. 9. Complex plan rules. Medicare Advantage plans can have intricate rules and requirements that beneficiaries must navigate. These include step therapy for medications, referral mandates to see specialists, or restrictions on out-of-network care. For new enrollees, understanding these rules can be overwhelming, leading to denied claims or unexpected expenses. Additionally, plans often require beneficiaries to be proactive in managing their care, such as scheduling preventive services or navigating prior authorization processes. Familiarizing oneself with the plan's details and seeking assistance from a Medicare counselor can help alleviate confusion and ensure a smoother experience. 10. Potential care delays. The structural requirements of Medicare Advantage plans, such as prior authorizations and limited networks, can lead to delays in accessing care. For patients requiring specialized treatments or urgent interventions, these delays may have serious health consequences. Additionally, navigating the bureaucracy of the plan's rules can consume valuable time, particularly for older adults or those managing complex medical conditions. Beneficiaries should assess whether the plan's processes align with their healthcare priorities and consider alternatives if they anticipate frequent or urgent medical needs. Thanks for watching the video. Please subscribe.